Hey folks, Dr. Gerstmar with Aspire Natural Health, checking in for day 13 of the 21-day Paleo Cleanse. Running a little late today, had a really busy day at work. I have to say my energy's been good, feeling good, and the convenience of not having to eat or prep and then have breakfast and lunch has really come in handy. Although let me say again, I'm very much in favor of whole, real foods as much as possible. Having said that, with our busy, hectic lives, sometimes subbing in a shake here and there can really make a huge difference, and not having to worry about it in the morning and afternoon has been maybe one of the biggest parts or one of the biggest benefits of this cleanse. The other thing that I can say I'm really noticing are that old cravings are falling away, and I can feel how it's getting much easier to realign diet. So as we come to the end of this thing, we're going to talk about the transition out of it and transitioning to some healthy eating habits. So this can also be a really great way to break some dysfunctional patterns that we may have with food or our eating habits. I wanted to pick up today and hopefully finish off talking about poop. As you know, as a gastro-oriented ND with a specialist in gut problems, poop is a big favorite of mine and something I spend a lot of every day talking about. Most people understandably want to avoid it, but it gives us a good window onto our overall health. So while it's never really popular, I do honestly recommend that at least once in a while, after you're done using the toilet, go ahead and take a look at your poop or at your stool and just get a sense, because if you notice something has significantly changed, then that's worth noting, and that can mean that something is going on, right? We can't or shouldn't often look at our blood or other tissues of our body. Of course, recommend people take a look at their skin, their nails, their hair, their eyes, things that they can take a look at. But poop or stool is one of those things we can check, which can really give us a better understanding of what's going on inside of us. So we want to get back to the question of what's the deal with cleanses and their seeming obsession with poop. All right, so if you remember from the last one, just briefly review here, we talked about how toxins come in two basic forms: water soluble, meaning they can dissolve in water, or fat soluble, meaning they can't dissolve in water, they can only dissolve in fat. All right, that's important because when we take in, through eating, breathing, drinking, water-soluble toxins, they can cause damage while they're in our body, but they tend to stay in our blood, are processed quickly, and then pass out in our urine. Fat-soluble toxins, however, come in things we put on our skin, food we eat, or fluids or liquids that we drink, but they don't easily pass in or out of our system, and once in, they tend to stay there. They're difficult for the body to get rid of. Now, when the body does tend to get rid of these, some of them, through the miraculousness of the liver, can be changed into water-soluble toxins and flushed out, as we said before, but some of them still really can't do that. Those are passed from the liver, once they've been processed, to the gallbladder, and then on into the intestines, where they become part of our poop. And then when we have a bowel movement, they pass out of our body. So the way that we get rid of these fat-soluble toxins is from the liver, to gallbladder, to the intestines, and out through the poop. Right? So this is why it's so critically important, just like we'd be saying, look, it's critically important that you pee. Most people are doing a pretty good job there, and the biggest issue that we have is just people not drinking enough fluids. So, a big part of any cleanse is not hyper hydrating or, having to spend all your time in the bathroom, but making sure that you're peeing enough. On the flip side, however, we see a lot of people who are constipated. The issue, of course, is those fat-soluble toxins are mobilized, sent down to the intestines, formed into poop, right? And they just sit there. Now we can have reabsorption of those toxins back into the body again. So you can imagine it's like setting out your garbage on your curb for your trash man to come. The trash man comes, picks it up, and throws it right back into your house. Not what you're looking to do with a cleanse. So that's why constipation or not pooping enough can be a really big deal, and why you'll see many cleanses will contain things to help you poop more. Often it's fibers or clays, the idea being to absorb that toxicity that's put into your guts. They can be laxatives, and we can talk another time about the pros and cons of some of the laxatives, but the idea is to keep you pooping. And then what's the deal with colonics or enemas, right? A lot of fear for people around these, but if we unpack what a colonic or enema is, it's putting a liquid through the anus, right, but going backwards into the bowel to go ahead and wash out the poop that's in the bowel and anything else, right? So we can again imagine, especially in more aggressive cleanses. The 21-day paleo cleanse does not need nor recommend doing enemas or colonics unless they're very special circumstances for someone. But there are some very aggressive cleanses that really almost mandate the use of colonics or enemas. The reason? We're mobilizing so much stuff out of the body and into the bowels that if we wait for a normal bowel movement, we'll already be reabsorbing some of that toxicity. So those again should be cleanses that are undertaken with the guidance of someone who's really expert at helping you through, not something you really should be doing on your own. All right, folks, we're climbing up into the 6.5 minute mark. I know I tend to go on, so I'm going to cut things short here. That is why pooping is such an important part of cleanses. And if you are constipated, you are not going to be detoxing effectively. Not because there's anything magical about poop or the digestive tract in that regard, but simply because the bowels are the way that our body gets rid of these fat-soluble toxins. And if we're not pooping, we're not getting rid of those toxins. All right, folks, that wraps it up for today. I'll be back tomorrow with my update, and we'll continue this whole process. At Aspire Natural Health, we are experts at treating gut problems, autoimmune diseases, and other there we go, back again. And other hard-to-treat cases. So that's gut problems, autoimmunity, and other hard-to-treat cases. If that's you or anyone you know, please feel welcome to contact us. We'd love to help. All right, folks, until tomorrow, take care.